Welcome back. Well, some medical care is on hold due to the pandemic, but what if you have a dental emergency? Our next guests want to keep those patients out of the ER. Dr. Lisa Teel is with Meridian Endodontics, Periodontics, and Implant Dentistry, and Kelsey Van Handel is a periodontal hygienist there. And I welcome both of you to the show. Good morning.
Good morning, Tiffany. Hi, thank you so much for having us on today.
Absolutely. Thank you so much for joining us. Here's a question for you. I think so many people are worried about this, if they've got a dental emergency. So let's talk a little bit about how you guys, Dr. Teel, are handling the pandemic with COVID-19 as dentists and endodontists.
Absolutely. So the pandemic has certainly changed everything about our current world, hasn't it? It's just really unbelievable. I personally am very proud of our professional associations for stepping up. This would include the Wisconsin Dental Association, the American Academy of Periodontology, and the American Association of Endodontists. And our local dental community has been tremendous in stepping up the efforts. We have been pooling together to donate the critical PPE that our healthcare providers need, including gowns and masks and many different materials, getting those equipment and PPE to the proper ground zero environments at the hospitals. Our current focus is emergency care. So our goal is to keep patients out of the emergency room. Tiffany, as you may know and our viewers may know, emergency infection can be life-threatening, so we do not take it lightly. In fact, if you look at the numbers, every 15 seconds in the U.S., an emergency dental visit is made in the emergency room. And that's over 2 million visits a year. And so we want to get those numbers down and preserve those resources. You asked about what we are currently doing in our office. So here at Meridian, we are a dual specialty office. And essentially that means we have two different specialists, endodontists and periodontists. The endodontists are at the forefront of treating those emergency pain levels, those big infections by doing root canal therapy, and our periodontists are on standby to remove teeth and do emergency surgeries. So we are really taking care of the community and working hard at that. And essentially, our goal is, again, to keep the patients out of the ER, as you mentioned, and also to take the great burden off of our nurses and our physicians.
Absolutely. I think it's so important that we leave the ER to those who are dealing with the COVID-19 pandemic. So I love that you're doing that. And I love to hear the exchange in the medical community with those PPE necessities, like you mentioned. Are there procedures that you're not doing in office right now that people should be aware they cannot go in for?
Tiffany, that's a really good question. So we provide a lot of services that are very important to patients' overall health and lifelong longevity. This would include treatment of gum disease, treatment of root recession, replacing teeth with dental implants to improve form and function. And those are all very, very important conditions and procedures to treat, but we are placing all of those on hold, and we are basically focusing on this emergency triaging and care for the patients to keep those patients out of the ER. So really focusing on significant emergencies at this point.
Very important. And I know, Kelsey, you're a hygienist. Let's talk a little bit about those routine cleanings, because we know how important that care is and that maintenance is, but we're not able to go in and do that right now. So what should patients be doing since they can't be seen for routine care?
Yes, Tiffany, thank you. First off, as the dental community, we were slightly disheartened that the words essential versus non-essential kind of took off as key terms during this pandemic. In the future, we don't want those terms to diminish the importance of periodontal care. We know periodontal disease is associated with heart disease, stroke, diabetes, and the list goes on. We do not want this to become an issue in the future. So what can we do at home? The American Dental Association does have guidelines based on significant research. The first obvious is brushing twice daily for a full 2 minutes, making sure you're spending 30 seconds in each quadrant, while also making sure we get something between the teeth. Flossing is difficult for most patients, so we do encourage the use of an interdental brush to stimulate the gum tissue and get where the toothbrush bristles cannot reach. Lastly, as a dental hygienist in the community, we are very focused on education. It's a large part of what we do on a daily basis. So kind of think back to your previous visits and maybe get some tips and tricks, and it's this time to really hone in on those skills.
It's our time to be good at our home routine with our mouth, because when we
Yes.
come back, we don't want to get scolded. Let's just to kind of wrap up, because we're running out of time, I want to make sure that you just remind people, if you do have an emergency, because those root canals, that pain, or even an infection can be life-threatening, what do we do if we're having that significant pain?
Absolutely. So we would recommend first you reach out to your primary dentist. If you don't have one, certainly you can reach out to our office. We are more than happy to get you the health care you need, triaging those emergencies, and we have a very safe, spacious, over-regulation, to be honest, environment where we can treat you, or at least get you to the right provider. And be safe, stay home, let's flatten the curve together. We are truly in this together.
I love that. Thank you so much for joining me, Dr. Teel and Kelsey. I really appreciate what you guys are doing and the information you shared. Thank you so much.
Absolutely. Thank you, Tiffany. Be
You
well.
bet. Here's the website you can go for more to learn more about Meridian. They've got offices in Brookfield, Shorewood, and Economowoc. It's meridianendo.com. And again, really just those very important life-threatening or infections or root canal appointments.